My name is Felice Tabwana. I'm a program specialist working with UNFPA in Tanzania country office. I'm also a professional midwife, and this video shows the central and strategic role of a midwife in Tanzania in achieving the 3 transformative results. In Tanzania, like in any other countries, the indicators are still very much challenged. We experience about 11,000 women are dying every year due to childbirth complications, which are preventable. The unmet need for family planning is very high, 22%, and is more higher among adolescent and young women. The gender-based violence, we still have about 42% of people who have experienced the physical and the sexual violence in their lifetime. HIV infection, though it has been going down, but it is very high among women, and particularly young women. Midwives are critical health workforce in Tanzania, contributing to 70% of the entire health workforce. And midwives, they are central and really critical health workforce in achieving the 3 transformative results. So in this video, we have midwives from clinical areas and practice, training, regulatory board, professional association, as well as the community. So welcome and stay tuned.
So given the situation, as stated, me as a midwife providing direct care to women and their families, we shall employ principles of respective maternity care, including challenging attitudes and practice of staff to ensure provision of non-discriminatory and quality services to adolescents and persons with disabilities. Also, midwives should partner with other healthcare workers, clients, and their families in supporting women and girls throughout the reproductive continuum of care. Hence, this will contribute to healthier families and more productive communities.
As a midwife working in the community, will make use of the existing community health systems, including community health workers, to educate and sensitize the community on the importance of women's right to make decisions about access to reproductive, maternal, newborn child, adolescent health. The importance of male involvement and early antenatal care booking, health facility delivery, and as well as postnatal care services. Likewise, midwives shall provide family planning services, especially in the rural areas, for greater reach, quality, and more client-centered approach, including addressing gender discriminatory traditions, beliefs, and harmful social norms that affect women's decision-making regarding sexual relations, as well as contraceptive use and reproductive health care. As midwives, preventing and managing of HIV infection, contributing to prongs 1, 2, 3, and 4. Midwives provide HIV preventing services to the community with focus on vulnerable groups such as adolescents and youth. Also screening all women coming to antenatal clinic to prevent mother-to-child transmission, as well as support care and treatment services in the designated health facilities and in the communities.
As midwifery educators, we are ensuring that we provide quality education within an enabling environment so that trained midwives can become competent in the provision of the best client-centered midwifery care. And for professional midwives to be able to contribute in achieving the transformative results, midwifery educators shall provide appropriate training in conformity with the international standards that are according to the International Confederation for Midwives guidelines. We need to ensure that essential midwifery skills are fully integrated in pre-service curriculum, and also provide capacity building for in-service midwives through various innovations. For example, we have an innovation whereby we have a mobile learning system that is used to train in-service midwives, and other approaches for us to ensure that midwives acquire and maintain life-saving competencies through continuous professional development, and also include supportive supervision and mentorship. But also as well, we have to strengthen an area of conducting research for us to be able to provide evidence midwifery care.
We, Tanzania Nursing and Midwifery Council, as regulator, our major role is to protect the public, to ensure that the public gets safe and quality midwifery care from the midwives. So our role is to recognize them and regulate them as professionals by registering and licensing. We are also providing them with guidelines and standards to make sure the care they are providing in a very good quality. And we are also obliged to join hand with other authorities and organizations to make sure midwives given incentives and they are providing care in a very supportive environment.
I am the president of Tanzania Midwives Association, abbreviated as TAMA. TAMA is a UNFPA strategic partner, and that's a key player in implementing activities that will help in achieving UNFPA transformative results. As a professional association, will play a key role to enable midwives to acquire, maintain, and use competencies to save women, newborn children, and adolescent lives. We will partner with other maternal and child health organizations to advocate for strengthening the profession of midwives in Tanzania. For countries that are struggling with poor UNFPA transformative results, call for action is invest in midwives. Thank you.